Good morning and salamat pagi. I work with the WHO Indonesia and I am based in Jakarta. And my area of the work is environmental health and food safety, so it also includes climate change and public health. So I am now trying to bring some scenario today with respect to this Southeast Asia region. As our previous colleagues, they have already linked this the climate change with the adaptation and the mitigation. I'm also in the same line, but linking more on the Asian perspective. So my outline of the presentations will be the anthropogenic sources of the greenhouse gases, vulnerability of the Southeast Asia region, climate-related diseases, key focus areas, regional response, potential adaptation measures, and finally a few recommendations. This is the climate extreme. The climate has both effects of the slow pace as well as very extreme, that as my previous colleague mentioned, hot is hotter and wet is wetter. So these are a few pictures taken the extremes with the climate change. Anthropogenic sources of the greenhouse gases, mainly the carbon dioxide, methane, and nitrous oxides. If we see this, the carbon dioxides, our waste and the sewage will produce around something like this yes, it will produce, waste and sewage produce something like 3%, deforestation 17%, farming 14%, industry 19%, commercial building and the residence 8%, transportation 13%, and power generation 26% of the carbon dioxide. Similarly, the methane gas and also the nitrous oxides, they are the sources, main sources for the greenhouse gas in the atmosphere. Here is the vulnerability of the Southeast Asia region to the climate. This is one of the picture that I put here, that the glacial lakes outburst floods, mainly it affect in the Himalayan region with the snow. And this is the picture that one of the ministerial cabinet meeting in Nepal, it was taken very close to the Mount Everest to mark on the event of one of the COP meeting on the climate change in 2009. So this shows some sort of the reflections that how the snows are melting very fast. And this is another picture from the Nepal, and it has compared in the different years starting from 1978, and it looks on this left-hand corner top that how the glacial lakes and how it goes in 89, how in 98, and lastly in 2004, even a person can just cross that the river course of the lake. So this way, all the glaciers, they are melting because of the global warming and the climate change effects. This is another picture. It has taken in the Maldives, which is a small island, like the many small islands here in Indonesia, that the sea level rise and the coastal floods have a big threat. And this is one of the occasions that the cabinet meeting was undertaken below the sea, inside the sea, and they are signing some papers. Next, please. This is one of the study conducted by CSIRO Australia. And here they are comparing the loss or gain in the various sectors because of the climate change. The loss is red and the gain is green. You can see here, more they are the red than green. Say the coastal communities, they have all the losses. Biodiversity, more loss. Infectious disease and the health-related mortalities, more loss but little gain. Water resources, almost all loss. Agriculture and the forestry. Forestry, sometimes, somewhere, it has certain aspects of the positive benefits, but there is still loss, and the regional economics. So this shows some sort of the glimpse that what are the loss and the gain in the various sectors because of the climate change. So the climate-related disease, as my colleague from the WHO already mentioned earlier that undernutrition in this region kills around 69,000 of the people every year. Diarrhea, it's 70,000. Malaria, 33,000. And the extreme weather events, it is something like 800,000. It includes some other disease as well. And most of these diseases, they are also linked to the global warming and climate change. This is another slide. It was a study in China on the schistosomiasis and how these schistosomiasis, this coverage is changing in patterns and how it is anticipated in one of the provinces in the China. It was taken the picture like this. And it was anticipated by the year 2015, this a part of whatever the efforts they are doing to control the schistosomiasis, it is rather more on the increasing trend than decreasing. Next, please. This my colleague already mentioned from Cambodia. Next, please. This is the climate change impacts on the other risk factors. Like when we consider the health at the center of the development, there are various risk factors. 2 times, if you can press. One more. Okay. There are many risk factors to the health, but all these risk factors are further exaggerated because of the climate change effects. See, for example, transport, migration, energy, degraded ecosystem, water scarcity, deforestations, chemicals, radiations, water, vector, air. These all things are further behaving in a very adverse way to the health because of the climate change effects. The most important public health problems from the discussions, what we can jot down is the communicable disease, food security, disaster risks, water quality and access, and disease vectors. So these are the major health problems and the challenges we are facing in the health sector. So WHO has estimated mortality due to the climate change in 2000 in the various its region all over the world. And what it has found that this region, here, Southeast Asia region, has the highest mortality with respect to the climate. It is around 82,000 in 2000, in the year 2000. Compared to the other region, even compared to the African region, or the Western Pacific region, this region has the highest mortality. This my colleague already mentioned, but I want to iterate here that the emission, whatever it is produced in the industrialized countries, has a lot of the impacts in the morbidity and the mortality in the developing country. If we inflate this, the emission in the upper picture, then the inflated disease mortality in the lower picture shows more effect in the countries of the Asia and the Africa. Next, please. So commitments to minimize the health impact of the climate change from the WHO side. There are several initiatives in the past. All Health Assembly resolutions of the 2008 is a very important one. World Health Day 2008, that was on the climate change and the health, if you remember. And New Delhi declarations on the climate change and health, that is for the Southeast Asian countries. Similarly, the WHO Southeast Asia Regional Committee resolution on the climate and health, and very importantly, Southeast Asia parliamentarians' call for actions on protecting human health from the climate change. So in 2009, All Health Assembly, they have passed certain concerns with respect to the climate change, and I have listed them, few here underlined. The first is the awareness raising at the different levels to understand climate change implications. Capacity building for the health risks assessment, collaborations of the health sectors with the other national and the global partners, and building up the scientific evidences and the informations to link health and the climate change, strengthening of the health systems, and commitment at the different levels that they collaboratively work together to fight against the climate change challenges. Next one. This one, I want to go back the history that in Bali 2007, there was a big meeting of the UN, and that was on the protecting human health from the effect of the climate change. And still, we remember it as a Bali Declaration, and it has given a lot of the guidance to the countries that how the health sector can very prominently work in the area of the climate change. The main objective of the Bali Declarations was to increase the awareness on the health consequences, strengthen the capacity of the health systems, and reduce now the health systems' greenhouse gas emissions, and health concerns are addressed in the major decisions of the nation. So the key factors or the key focus areas identify strategy and actions at the national level, and support health system to enhance capacity for assessing and monitoring health vulnerability, risks, and the impacts from the climate change. There are few publications WHO has jointly worked with other partners, and it is very easily accessible in the WHO website. Most of them, they are free of cost. So I suggest these books are very good to deal with the health, climate, adaptations, and the mitigations. So the another aspects of the focus is the share knowledge and the good practices, whatever it exists, generate the evidences at the country level, and build inter-sector collaboration. So this can be put in the diagram like this. So addressing to the various implications of the climate change and the health, it starts from the evidence, strengthening of the health system, building up the partnership, and the raising of the awareness. So these are the key points that it keeps on rolling around to give the momentum on the actions to the health and the climate. Few updates from the WHO. It has happened in last couple of the years in this region. First one is the regional actions on the climate change and the health. WHO has developed teachers and the students' guides on the climate change and the health, together with the training module on the climate change and the health. These are also available in the WHO website, and it was first produced on the All Health Day 2008. Second is the Southeast Asia Regional Parliamentarians Conference on Protecting Human Health and the Climate Change, and there is a declaration of the parliamentarians in 2010. Similarly, there was a preparatory meeting for the COP16 in the 2010, and the regional strategy on the climate change and the health was first time developed by the WHO. Here it is in the line of the update. There is a tool known as the retrospective study protocol to assess the linkage between the health and the climate, together with the diarrheal and the vector-borne diseases. In India, there was the health vulnerability and adaptation assessment. Environmental health conditions in the primary health centers were assessed. Some example from the Sri Lanka, that the climate factors and the occurrence of the dengue fever, dysentery, and the leptospirosis, they were linked. Similarly, in Bangladesh, a study to assess the socioeconomic, health, and the livelihood conditions of the coastal people affected by the natural disasters were conducted. 2 new projects in Bangladesh and Nepal, protecting health by strengthening resilience of the drinking water and sanitation surveillance to climate change. In Indonesia, pilot on the community vulnerability assessment and development of the health profile of the climate change. This health profile basically linked the meteorological data with the disease epidemiology. Similarly, the WHO water safety plan to improve drinking water quality, it has been now at the pilot scale in the various countries, including Bangladesh, Bhutan, Indonesia, Myanmar, Nepal, and the Timor-Leste in this Southeast Asia region. Similarly, the climate and the health is also now been incorporated into the disaster risk reductions and the preparedness. And Bhutan has a small project to build health adaptation capacity. So the example of the adaptation measures in the region, Bangladesh, they have a cyclone shelter like the top. They have built the cyclone shelter. Similarly, India, there is a risk reduction interventions based on the primary hazards. In Nepal, they are conducting water-related disasters planning and intervention. In Bhutan, the preparedness and the contingency planning under the multi-sectoral framework of the country. And in Indonesia, it is a decentralized crisis management centers. They are functioning in the very good cooperation to each others, so that the crisis-prone country and many crises, one way or the others, are being tackled through this center. Potential adaptation measures. Just for the example, I have brought here few. This is the alternative sources like the rainwater, wastewater, recycling, desalination, climate resilient technologies, upgrading water treatment capacity, sanitation technology that use less or no water, inclusion of the climate risks in the water safety planning, household water treatment and safe storage. Few others, integrated water resources management, climate resilient crops, adjustment in the cropping pattern, safe use of the wastewater in agriculture, health and agriculture sector to coordinate and promote nutritious food. Similarly, linking disease surveillance with the meteorological data, improving working conditions in the places where the workers are at risk. It is more on the occupational health and safety, improving environmental sanitations and the water source practices, especially in the high-risk communities. So this is my last 2 slides on the recommendations. Development strategies must address the health risks of the climate change, as well as promote low-carbon strategies that improve health. Whatever the development strategies in the country, the health and the climate need to be incorporated. Fostering partnership, it is on the health protections and the health promotion in the climate change talks and the negotiations and the health concerns in the various COPs and also the resource allocation. Strengthen or expand collaboration with the meteorology, mainly to develop early warning systems, disease surveillance, risk mapping, climate and health study and the research. Similarly, on the policy side, it is the policy of the key sectors, for example, energy, transport, agriculture, environment, water, education, to adequately address health concerns, strengthen disaster risk reductions, and emergency preparedness and response. So when we say this, the DDR, that DDR has also to take this the climate change effect as one of these the emergency conditions. Keep human health at the core of the national adaptation processes for the climate change, including national adaptation plan of actions or national adaptation plans. Thank you very much.